Good morning, afternoon, and evening, folks. It's Harry Mullen here at CSS Nation and my co-host, Pernell Husband. How you doing, Pernell?
I'm doing very well, Harry, and how are you?
I'm doing excellent. All right, so to get things started off, first of all, just want to remind everybody that you can follow us on our YouTube station at Central Sterilization Solutions. Be sure to smash the like button if you like us and subscribe. Well, Pernell, today is a special day. I just wanted to wish you a very merry, happy Father's Day.
Thank you, sir, and the very same to you.
Yeah, and happy Father's Day to all of you dads out there. I know that you're not watching the show, but later on in the week you're going to be watching it because you're spending that much needed time with your family.
Quality time.
Absolutely. So let's go ahead and get into today's topic. Today, Pernell wanted to discuss AAMI, the AAMI standards, and what it means, because technicians have heard about the AAMI standards for a long time. Some of them even have copies of it in their department, some don't. And but we have some viewers that I know that are fairly new into the field, and so I wanted to start off by explaining to them, first of all, what is AAMI, and how they started and all. And then maybe go into one particular topic that we could cover today. So how did AAMI, when did it start and everything, and who created it?
So back in 1965, a couple of gentlemen by the names of Robert D. Hall, Jr. and Robert J. Allen founded the Association for the Advancement of Medical Instrumentation, the organization that we affectionately call AAMI. This organization was developed for the advancement and safe and effective use of medical technology, which obviously includes instrumentation. Robert D. Hall Jr. and Robert J. Allen. And as you know, Harry, the AAMI standards are the Bible, so to speak, for sterilization standards.
That we actually, we do consider it, the Bible of sterile processing, because it tells us everything we need to know in order to live a good, healthy life in sterile processing.
Absolutely. It does.
So one of the, the main books that they have, or the standards, is ST79. Can you go into a little bit more history, or, give us more information about the ST79?
So absolutely. By way of just a little bit more background information, today AAMI members include decision makers of all stripes. It includes clinical engineers, biomedical equipment technicians, manufacturers, sterile processing professionals, even researchers, quality assurance folks, regulatory affairs experts, and a whole host of other healthcare and technology management professionals. So AAMI sterilization is just one part of what this organization does. And of course, that's where we as sterile processing professionals come in. But AAMI is broader than that. In 1966, AAMI was introduced to the public at large through what was called at that time the MEDAC 66. This was a medical equipment display and conference held in Boston. Dr. Michael DeBakey of cardiovascular surgery fame, as many of you know, Harry, he invented numerous instruments.
Yes.
He was one of the key figures who attended that meeting, that conference back in 1966. Him and Dr. Kantrowitz introduced the world's first artificial hearts back then under that AAMI banner. And there they had a good and constructive debate about the use of that kind of transplant technology. In fact, over 7,000 individuals, hospitals, and medical device manufacturers are now a part of, are members of AAMI today. Harry, why don't you tell us a little bit, some quick facts about AAMI guidelines?
Well, you know what? The use of standards, as we all know, is voluntary. You know, so we have the standards that are performance-based documents that serve to help us in sterile processing in the industry with our performance, how we use things, the acceptance, and the advancement of health technology by outlining performance and safety requirements for any particular device. As well as standards may also be used to orient and promote safe use, application, and also maintenance of health technology in the healthcare delivery setting. So, you know, what they do is they really, kind of dictate to the vendors or to the manufacturers, you know, how it is that the information should be presented to the individual so that we know how to properly operate their equipment, how to process their equipment and such. Absolutely. So the other thing is that as you can see up on the screen here was the 5 original documents that were created back then. So we had ANSI AAMI ST46, which was the original steam sterilization and sterility assurance in healthcare facilities. Then you had ANSI AAMI ST42, steam sterilization and sterility assurance using tabletop sterilizers in an office-based or ambulatory medical setting, surgical setting, or dental facilities. Then we had AAMI ST37 for flash sterilization, you know, for patient care items that were needed immediately. And then we had ST35, safe handling and biological decontamination of medical devices in healthcare facilities and non-clinical settings. And then finally, ST33, the guidelines for the selection and use of reusable rigid sterilization containers, systems, for things, you know, being sterilized, let's say using ethylene oxide sterilization or steam sterilization within the healthcare facility. And I think it was very insightful of them way back when, considering that AAMI started back in the mid 60s. So it just kind of shows you how long the debate has been going on and the discussion as far as the use of these types of items.
Absolutely, Harry. A long time, over 50 years. I remember so clearly the first 2 on this list, the standard 46, the steam sterilization and sterility assurance. I think the first time I saw that document was when I was in the Navy, and then ST42, standard 42. Steam sterilization and sterility assurance using tabletop sterilizers. Again, out on those ships, we on some of the smaller boats, you have some of those smaller tabletop sterilizers as well. So these were the 5 original documents or standards that AAMI came out with. Let's talk a little bit about committees. AAMI operates largely by committee, groups of professionals working on a specific area to come up with either standards or information for users. AAMI committees develop standards and other types of technical documents, all with the same goal in mind: to enhance the safety and efficacy of the use and management of medical devices and healthcare technologies. These documents are classified according to their objectives or the level of consensus they reflect. The types of technical documents are described as H.
All right, so the first one we have are standards. Now, standards are consensus documents that provide requirements, specifications, guidelines, or characteristics that can be used consistently to ensure that the materials, the products, the processes, and the services are fit for their purposes. Now, this is one thing I like about AAMI is the fact that, they get a consensus on what it is that should be delivered to the industry. So it's not one person's view. Everybody gets a chance to voice their opinion. And then if there's a general consensus that this is the proper step, then they go ahead and implement it. And then later on down the line, we have best practices coming up that may change those standards in the future with further consensus. So I really like that concept.
That whole committee consensus approach. Yeah.
Yeah. And as it says here also, AAMI develops standard documents that are aimed at enhancing the safety, the efficacy, safe use, and management of medical devices and health technologies. And we need to remember that a standard may recommend to a manufacturer the information that should be included with the product, things like basic safety and performance criteria, as well as conformance measures that can be used to assess compliance. So again, it goes back to the manufacturers stating that, if you really want our professionals to be able to understand and know how to effectively process or use your product, you need to set down in writing a certain way of explaining that. And I love the fact that AAMI gives them those recommendations. Now, it's not mandatory that those vendors, go ahead and give out that information in a certain manner. But since a lot of these vendors probably sit on the AAMI standards board, they're more apt to go ahead and follow those recommendations. Next, we have the TIR. And I always, was like, well, TIR this, TIR that, what is a TIR? And come to find out, it's a technical information report. All right, so this report is a review of technical issues that are going to be relevant to a particular technology and a statement of expert opinion. So a TIR may include discussions of different sides of an issue or may be issued when a committee believes that the procedures for developing a standard would unduly delay the promulgation of needed information. So it's like, okay, they go ahead and release the information so that way we can get started. And then they release a report, that gives the point of view from both sides as to how they came up with this, which is good because it ultimately goes back because it's a standard and standards are not regulations. When we know the mindset of how this standard became available to us, if it allows the facility to actually go into and look at these technical information reports and do their own studies to come up with their own best practice.
Right, and as it says here, there are times when that TIR will proceed or come out before some regulations. So it could be something like, so here's the current information and discussion that we have on this topic, right? This is what you get for now. Read all about it.
Right.
Later, some, regulations may follow, like, ST79 may get revised. and then that information may get added in at some point.
Exactly. So it's really interesting to know that a TIR can come out beforehand. Like it says, it's, this is information that's needed. So that way we're not going to be delaying the procedures and processes and how we're supposed to be doing things. And a TIR can also come out afterwards, after a standard has been developed, and to give additional clarification. So I really like that. And then we have American National Standards. And this is a document that has been sponsored by an ANSI accredited standards developer, such as AAMI. AAMI is one of those such organizations, and achieved consensus, which met the ANSI essential requirements, and then has been approved by the Institute. Now, AAMI may choose to submit its standards or TIRs to ANSI to be designated as an American National Standard. And the ANS designation, which signifies that the documents have been developed in accordance with the ANSI requirements for consensus, due process, public review, and review of ANSI. And the American National Standards are designated by the following text in the title of the document, ANSI AAMI. So, Pernell, why don't you continue on and tell us about consensus reports?
Absolutely. Consensus reports, or CRs. The objective of a consensus report is to provide concise, prompt, and practical guidance on narrowly focused topics of high importance to the health technology community. A consensus report is intended to respond to an urgent and immediate need for guidance in the following instances. While more robust data or information develops on emergent areas, so there's a new technology that is emerging, that is in use, but we still need further study. A consensus report can come out and say, so here's where we are with this particular technology. Here's what experts in the field think. There's still discussion and development of standards to come, but in the interim, here you go. When variation in the development, implementation, or use of a product or process exists, so there's something being developed and there's wide variation, right? And whatever it is being implemented in a variety of different ways. So a consensus report comes out there and attempts to clarify on whatever the particular issue is. Also, when existing standards or other documents require additional context or clarification, a CR would be useful. A consensus report is based on the collective knowledge and experience of stakeholders within the healthcare technology community. Consensus reports. U.S. adoptions of international standards in line with AAMI's standards philosophy, that standards should only be developed when there is a clear need and that there should be one product or process and one standard worldwide. AAMI will often facilitate the adoption of international standards as US standards. So AAMI is that body that would look outside to Europe, to Asia, to wherever there has been a consensus met on a particular standard. If the standard that already exists is something that makes sense and a consensus, people agree in AAMI that this should be adopted as a standard, then the agreement is made. The adoption of international standards is carried out through US TAGs, whose primary purpose is to develop and transmit the US position on draft standards to the appropriate international technical committees. US adoptions of international standards are designated by the following text in the title of the document: ANSI, AAMI, ISO, or ANSI, AAMI, IEC. Which brings us to Mr. H, AAMI's Standard 97, which is the standards for steam sterilization in healthcare facilities. 7.4 of that standard is decontamination. Harry, should we take a look at this particular standard?
I think we should. I think because, as we know, everything within the hospital, everything within sterile processing begins, with coming into our department through decontamination. Now, we know that ST79 does not just cover steam sterilization, decontamination. It also goes with the design of a department and stuff. It's really a broad standard. But I think of all the standards within ST79, I think 7.4 is a good place to start.
Well, Mr. H, let's get started.
All right. So we have here, again, now this is taken right out of the first section of 7.4 under decontamination. And so it states that 7.4.1, these are the general considerations for all devices and utensils. So these are the basic guidelines that we're going to be following for pretty much any type of device that's coming into decontamination. Now, as you'll see, practically on every line here, it really is going to really be dictated by what the manufacturer says. But let's go ahead and cover this real quick. So, to help ensure effective decontamination of all of our devices, sterile processing personnel need to look at the following items. And when we're talking about devices, we're not just talking about surgical instrumentation. We're talking about medical equipment, electrical medical equipment, devices, containers, you name it. All right. So the first one here says, follow the device manufacturer's written IFU. And we should all know that IFU stands for instructions for use to ensure proper decontamination and disinfection of the device. So ultimately, again, it goes back to the manufacturer and what it is that they say that their device and how it needs to be processed, which is going to dictate what type of materials are you going to use? What are the chemicals? What are the timelines? Does it need soaking? Scrubbing? How is it to be done? So there's so much information that you need to make sure that you have access to these materials, these instructions for use within the decontamination area.
And B, Mr. H, collaborate with clinical personnel to help ensure that instruments are kept as free of gross soil as possible during the surgical or other procedure. Now, we all know and understand that surgical technicians are taught, and an expectation of them is that they keep the surgical instruments free of gross soil during the actual procedure or surgery. There's a saying in the operating room world: decontamination starts in the OR. Critically important.
Absolutely. Starts at the point of use. Absolutely. And then we have C. So begin decontamination as soon as possible after the items have been used or as directed by the instrument or device manufacturer. So again, the decontamination needs to start first at the point of use. Now, as stated in B, the gross soil needs to be removed. And then those instruments, as stated in C, because the cleaning and the decontamination needs to start right away, they need to be pre-treated with things like enzymatic solution that you can spray onto it, or keeping the instruments moist by putting a wet towel over it. And what that does is that creates it kind of like a humidity layer, so that way the instruments do not dry. Because as we know, if we're not able to clean right away, we need to make sure that those instruments keep moist, because if the instruments are allowed to dry, it makes it much more difficult to clean, and then it's going to cause delays later on down the line.
Absolutely.
All right, so again, and we need to make sure that we're following the manufacturer's instructions on how to clean those devices. And again, going into cleaning as soon as possible, flexible scopes, they actually have a timeline that once the scope has been used, you have X amount of time to start the cleaning process. And if you don't hit that time, then there is another section in the IFU that states that you have to do extended cleaning, extended soak times and such. So again, and that could be several hours. They might say that you need to soak this scope for in an enzymatic wash for 2 hours or something. You really need to go to that manufacturer's instruction.
That's right. D, separate general operating instruments and utensils from delicate instruments or devices that require special handling. Again, what we are reviewing right now is AAMI, the Association for the Advancement of Medical Instrumentation's Standard 79. That standard, ST79, is what professionals in central service and sterile processing look to for best practices. This is where it comes from, ST79. If you are a central service professional, you need to understand and you need to know Standard 79. We're exploring right now 7.4 of that particular standard, which is decontamination.
So, and then section E here, you need to make sure that you're disassembling all your instrumentation. So any device that is comprising of more than one piece, for example, Yankauer suction. Typically, the tip screws off, so that way you can make sure you get into all the crevices. You have Balfour retractors that come apart. You have Finichetto retractors, chest rib spreaders. And all of these need to be taken apart because we have hidden crevices in areas where bioburden can get trapped, and then biofilm can be formed. So you want to make sure again that you're following the manufacturer's instructions on proper disassembling and cleaning.
That's right. F, we want to open all jointed instruments. So again, these ringed instruments need to be in the open position for obvious reasons. They're sitting in the washer. The impingement forces need to make contact, direct contact with the entire surface of that instrument. So again, all hinged instruments need to be in the unlocked position.
Absolutely. In G here, it says pre-treat the device according to the manufacturer's written instructions. So it's letting you know, is there a particular chemical that needs to be used? Pre-treating, meaning before you're actually doing the cleaning. And one of the things that I would probably challenge the AAMI group is G. Is it in the proper location? Should that be up closer, being number C instead of G? Because again, when we talk about after B, collaborating with clinical personnel to ensure that the instruments are kept free of gross soil and stuff, and the fact that cleaning begins at the point of use, so a lot of times when you read the AAMI standards, you're looking at the fact that it's almost dictating in what order you're supposed to be doing things. And so I kind of challenged them to see if G, although it is a proper statement, is it in the proper order? Should it be at higher up on the list here?
H, use a cleaning solution that is compatible with the device and follow the cleaning products manufacturer's written instructions for proper dilution, concentration, temperature, and contact time. So again, we always want to make sure that whatever cleaning detergent, enzymatic solution, what have you, is compatible with the item that we're trying to clean. For obvious reasons, if it's not compatible, then there may be some damage to the device or to the instrument. Or if it's not compatible, we may not be effectively cleaning that item. So we talk about IFUs all the time in our training when we are consulting instructions for use. That is the manufacturer's guidance on how to take care of the item that they created, and we take care of it in such a way that they have tested it. So they test it with certain chemicals, with certain detergents, with certain temperatures, and then they put that in writing, and that's what we should be following. Compatibility with chemicals versus devices and instrumentation is critically important, as outlined here by AAMI.
I like this next one, I. It says that before manual cleaning, ensure that the cleaning solution is clean and change it when it appears soiled, which could be one use, immediately afterwards. And this is a good one because, Pernell, as managers, as we've managed departments, as we're teaching the course, the question comes up, how often should I be changing my sink? And I can tell you, some 30 years ago, we would fill up a sink and and if I was in there for 2 hours straight cleaning instruments, I'd use the same water, so it was nice the fact that this was put in there to let us know that really you need to be inspecting your solution to make sure that it's not cloudy, that it doesn't appear soiled, and to make sure that you're because we don't want to cross-contaminate from one set of instruments to another. So I kind of like this one.
Moving on to J, rinse with water of the quality specified by the device manufacturer. When the water quality is not specified by the device manufacturer, refer to AAMI TIR 34. So we want to rinse, typically in sterile processing in the decontamination area. The final rinse on your washer decontaminator is going to be of a treated water variety. So the water is filtered or purified in some way. Same thing at the sink, or it should be. If you're doing your final rinse at the sink because the item can't go through the washer, it should be purified water. Typically, the manufacturer specifies, sometimes they don't, and the guidance here from AAMI is, if it is not clear, then we are to refer to the what does TIR stand for again, Harry?
Technical, technical information report or advice? Yeah.
Technical information report, number 34, whatever that is.
Also, make sure that you do not treat instruments with any additional chemicals. So in other words, number one, we don't want to add chemicals that are not needed. Oftentimes your enzymatics should not be mixed with other types of enzymatics because they can cancel each other out. You don't want to be adding alcohol to the mix when it doesn't require it. So again, you need to go back to the manufacturer's instructions of not just the manufacturer of the device, but the manufacturer of the chemical as well.
Use non-linting cloths in central service. We don't use linting cloths because those small particles can end up in the patient's wound and become a foreign object and cause all kinds of issues. So we want to make sure that we're using non-linting cloths.
And this one I like, use the appropriate size brushes to clean after and then clean them after each use. Now we're talking about specifically maybe reusable brushes here, but as far as the appropriate size brush, if the brush is not, let's say you're going into a lumen, so you have a brush that's circular, it has bristles all the way around, and if it's too small, it's not going to come in contact with all surfaces of inside the lumen. If it's too large, you're potentially causing damage to the inside of the instrument. So you got to make sure that you're always wearing using the appropriate size brush. And when it says here, clean after each use, this is specifically talking about reusable brushes, that they need to go through the same decontamination process as any other device. Personally, in my departments, I like to use disposable brushes.
Yeah, I agree. Lot less confusion. I think most people have gone in that direction. Most managers, most directors have. It certainly is easier. You use it, you toss it. Inspect instruments for flaws, debris, and detergent residue. Again, it's our job. We're decontaminating, but we are also using our vision. We need to be looking for flaws. The earlier it's identified, the faster we can provide a solution. So the quicker that we identify it in the decontamination area, the quicker that we can do something about it. So
which means we should have additional tools at our sink, mounted magnifying glasses, proper lighting, and everything, so that way we can inspect and find flaws, debris, and such. Well, Pernell, I thought that was very interesting. This is a good place to go ahead and end. I believe that it was a great introduction for people to understand what AAMI is, more specifically ST79, and delving into the beginning of decontamination. I know there's a lot more information to come when it comes to what the standards are within decontamination. We're just scratching the surface right now.
Yeah, Harry, absolutely. AAMI is one of those organizations that is critical to medical device reprocessing. As we mentioned at the very beginning, the main standard that is used practically worldwide when it comes to standards for steam sterilization in healthcare facilities is Standard 79, more commonly referred to as ST79. Today, we took a brief look at 7.4, which is the decontamination section, part of the decontamination section in ST79. I thought that was a good first look, H. I agree.
I agree too. Also, just to let people know that Mr. Pernell and myself, we are available to come out to facilities and do training. We also do assessments for survey readiness and competency trainings. So if you're needing to get a hold of us, you can see our web address at the bottom of the screen there at centralsterilizationssolutions.com. Again, that's centralsterilizationssolutions.com. And so we're available for you. So,
absolutely.
Outstanding show. I just, before we go, again, I wanted to say, Pernell, happy Father's Day.
Thank you, brother. I appreciate it, and the same to you.
And any last minute words you'd like to share?
We'll be back.